Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we are on a mission to help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Vivek Hegde with us. His achievements and acknowledgements are not hidden from anybody of us. With he being the president of Indian Endodontic Society, as well as the Indian Oral Laser Society, he's also the founder of One Dental, as well as his clinic, the White Arch Dental Clinic in Pune, as well as he is the vice dean of the Rangoonwala Dental College in Pune. So we welcome him here on the platform to understand different kinds of career prospects with after BDS and MDS. What can students look forward to? How are the time changing in Corona, and how can you positively look forward to the times and make the best out of it? Welcome, Doctor, to the platform. It's really nice to have you here.
Thank you so much. Thank you.
Yes. So Doctor, just wanted to understand, now students after, the recent dental graduates are really confused how things are changing with Corona. What to do? Should we set up their own practice or should we go abroad? What is your suggestion on, on that front?
All right. Thank you, Dr. Ayushi, for inviting me here. It's always a pleasure. Like I said before the interview began, for a social cause, I'm always here. And I like pepping up the youngsters.
Yes.
Actually, when we did our education, there's hardly any talks by somebody or motivational lectures, or we didn't know which side we were going. For that matter, most of us were going to MBBS, and somewhere down the line, because that year the seat was not available or whatever the reason, you become a BDS. Okay. So most of us in my age became by chance and not choice.
Yes.
But today I want the young generation to follow their passion. And I know this is not a good time. It's testing times. Corona has hit all of us in different ways. Even if we all have established practices, we still have got affected in many ways, but that's okay. We still have to sail through. We will fight through it. But for a beginner, I know it's difficult. I still feel when it's a beginner, there are a lot of career prospects. Firstly, if you're a BDS, the first best option is to be an MDS. But MDS is not the end game. Let's be clear. Okay. I want all of you to think that even after BDS, there are so many successful practices. Or after MDS, you can't say everybody has been successful. So that's a personal choice. Now, if you have a choice to do an MDS, and if you're liking a particular subject, please take it up. It's important. Okay. Because in general dental practice, that's BDS, you have to do almost everything, which is possible. But then you have to be a jack of all trades and maybe master of some. In a specialty base like mine is Conservative Dentistry and Endodontics. So I do that to my best and I'm very passionate about it. But even if I get a mobile tooth to extract, I don't do it. Not that I don't do microsurgeries. I do a lot of apical surgeries. If I can do an apical surgery, I can very well place an implant or extract a tooth. But I respect each profession. I believe we have to work in collaboration and not competition. Having said that, for beginners, I want to tell you all, start focusing. Make a game plan. What do you want to be 5 years from now, 10 years from now, or at least in 15 or 20 years? By then, if you pick up the train or catch the bus, you're going to go there. A lot of us, at least in our generation, we didn't have any direction. We just got up and started working. We worked for the day, went for the next day, came a year, and then we didn't even look back. When we look back, we'd already lost a couple of years. At least me, I had lost 5 years. Then I'm thinking, what am I doing? I'm a so-called MDS, but I'm just running from place to place without any focus and direction. And by the time I got my thing back, it was quite some time. I'm glad I'm back on track today. But for youngsters, first important suggestion or a request. I know you have your parents, your in-laws, or your teachers, but nobody can come and do beyond what you can do. So firstly, be the you want to be. That's my request. So what you want to be is your choice. Plan it. You can be a teacher, you can be a researcher, you can be MBA graduate, postgraduate, after BDS or MDS, and then go into marketing, go finance. You can be a blend of clinician, come any one of these. You can open your own academy, you can go abroad and work, you can work in India. Plenty of options. There are people who have also migrated from dentist to veterinary dentists. Why not? Options are plenty. During my time or above, the only teaching was one good option, fixed option, because government jobs, fixed salaries, good perks, and easy life. When I say easy life, evening was easy. There was no practice. And dentistry had not developed that much. But early 2000, you saw a lot of mustering of colleges. Then a lot of clinicians got jobs, full-time, part-time, whatever you want to call them, and they became both. So you can become best of both. You can go and work in a corporate setup. You can be a consultant. You can do a group practice. You can be an associate partner. So plenty of options. Like possibly what you are doing. You're doing something very different. That's also a noble cause. Why not? But I want you all to draw your chart, your plan. That's missing in most of us, especially youngsters. They've got the energy. They've got the drive. Somewhere I feel the focus is not there. The focus came even to us only when the maturity came. And that'll come only with experience. That'll take some time. So my request to all the youngsters to just conclude this question is, be the you want to be. That's it, period.
Okay. Really nice to hear this, sir. So now, after having a focus, now when it comes to, there is a big question these days to moving abroad. What do you think around that? Is this something that, how is it, just wanted to understand your opinion around it.
See, the grass looks greener on the other side always. So I know people who have done well and also people who have suffered. You have a big plan that I want to make it mighty big. It's not always possible. See, I'll tell you what, if there is something in you from within, you can make it anywhere. Be it India, be it abroad. Going abroad, I know some countries will treat you as like a second-class citizen. That's your wish. But the point is, if you're thinking of settling abroad, please think of countries that are developing countries. Now, when you're settling abroad, I don't know if this question is related to higher studies in settling abroad or getting a license or a job to work, say, in the Middle East or some other country. Both are possible. Going to Middle East or to Saudi or any other country is for money. How much you'll grow beyond that, I don't know. Possibly 5 years, 10 years down the line, I don't want you to get stagnated. There may be money. Then you want to come to India, you lost the grip in India also. Everything is a personal choice. Sometimes, halat bolte na, the situation around you also will not let you do everything what you want. But give it a try. Don't be a person who has never tried. Maximum what can happen, I have tried to go abroad. Why you? In 2000, I got to go to US. I got a chance to go to the Middle East. I didn't take any one of those. US didn't really happen because when Osama bin Laden's bomb dropped, it literally dropped on me too. Okay. So it didn't work for me. Okay, that's a different story. But the point I'm trying to tell you is, if you're going abroad for studies, if you have support or if you have a sponsored seat like a grant, please take it up. Okay. Go to a good university. Focus the line you want to be, not just forcing yourself to take some public health dentistry and just go be there. The public health dentistry will help for who, where their husbands are already there in software and they just want to support their husband and get some job to just be with them and spend some time maybe, a little money. But that's not a big achieving goal, to be frank. So that's a personal choice. Going abroad is fine. But there's struggle there too. It's not easy. I know people who've gone abroad, who've fried burgers, who have done car parking, who've done many, many odd menial jobs. Today, they're well positioned. Some tell it, some don't tell it. It's all okay because there's dignity of labor abroad. I don't mind about it. But the point is, If you've gone there, don't come running back. Because you go to abroad, I've seen many of them getting a degree there, whatever it is. When you come to India, the Dental Council of India recognizes only Indian degrees. The Western degrees will not help you to get any job. You still work in your clinical practice, maybe with a little more experience or a little more practice. Yeah.
Correct. Thank you so much, sir, for guiding in this direction and guiding it so well. So now when it comes to, masters, there is, as you already mentioned about, having a focus. So how does masters actually help? Does it maximum of the after PG try to do general practice? Do you support that? How do practitioners now should practice after their masters? What is your suggestion on that?
Once you're a master, I think you should focus on that deeper. Like I said, our clinic is called the White Arch Dental Center. We have a specialty-based practice, but there are different specialists coming for those. Like I said, I don't do implants or I don't do full mouth rehabs anymore. I only do my specialty. My wife is a periodontist implantologist. A prosthodontist comes for the superstructures. We have an oral surgeon coming we have a pediodontist coming. So we have a team of doctors coming in. There are also general dentists helping us to build up our practice. So it's a team effort. Everybody has incentives. Everybody has their own way of earnings in this place. That game plan, you can decide to do how you want. But if I end up doing everything, I can't go deep into what I want. And if you want to create your name to where you want to go, I think you should start picking up that one thing that you like, go deep and do it another way where nobody can do it that way. There's competition everywhere. In your hometown, in your locality, or you want to be local or global, your wish. But when you focus on that one thing that you can do so good that nobody else can. That's important. If you end up doing everything, doesn't make any sense. Choice is yours again. But I think, we all work for money, I know, but money should not be the driving force. Work with passion, work with depth, money will follow. That's what I believe in. Money should not be the primary aim or the goal. It's not difficult. Put a price to yourself in your practice. If there are people respecting, there are dentists who respect us, they refer cases. There are people, doctors, patients, all refer to us. They walk into us. It's taken time, of course, not overnight. Like I always call this, the commander's rule. You know what? When a pilot becomes a commander, I'm repeating it. I've already told earlier in another platform. A pilot becomes a commander when he flies only when he completes 10,000 flying hours. So if you spend 6 to 8 hours a day, 6 days a week, 24 days a month, or 25, or if you're working on Sundays, I don't know, 12 months a year. If you keep continuing doing the same thing, give yourselves 8 to 10 years, you will do the 10,000 hours. And passionately, like I do a lot of, say, endodontics. My 10,000 hours are done. Today, I'm seasoned. There's no other way except being good, but be passionate when you do it. Try and improve from the previous time. You have to compete with yourself of what you were yesterday for a better tomorrow. I don't have to see what my neighbor does. He may be good. He may be better than me. Doesn't matter. I have to only compete with myself. And that's what I've been doing all the time. At the end of the day, I do constructive criticism of myself. I spend some time to myself, like how did the day go? For example, if I've done a good case, I will pat my back. If I knew I could do better, I will pep me up and say, okay, no, tomorrow I need to do it better. So this is how you go. Mistakes happen with everybody, okay? But understand one thing, mistakes are a rich source of learning. Nobody is fooled to perforate a tooth or break a file, but it happens. But see that it doesn't happen again and again. That's what is how you learn from yourself, from others' mistakes. That's a request. Yeah.
Correct. So that's so true. So now when you explain about, focus with MDS, it understands. What about BDS? Can they also, create a focus somewhere? What do you suggest for them?
Of course you can. Like I said, I can name so many of the BDS people, India and abroad, who are focused on one particular thing and got deep into that. And today they are teachers. People refer to them. So it's not about BDS or MDS. Let's be clear about it. Even as a BDS, I know some of the clinicians who are excellent. But yes, MDS is a cutting edge. Now, with this question, I want to put one more thing. Firstly, you should be a dreamer, okay? I don't know if you're all dreamers. Dream is not the one that you get while you're sleeping. Dream is the one that you get while you're awake, or the one that doesn't let you sleep. That's important. I asked myself one question, this question long back. I said, okay, I want to be known by a lot of people around me. Okay, this was my dream. Forget the money part, that's later. This is what my dream was. So then I said, yes, I want to be remembered by everybody. The next question came into my mind, why should I be remembered? Then there's a problem, there's a solution. Start working towards it. So you start thinking what you want. So I wanted to focus on that one thing that you want to do. It's possible, but give it time. There are 10 different things I have tried and I've failed also. Maybe there's no time to explain that. It's not my story here. I'm talking to you all so that you all get the best of what's in today's trends. The biggest problem in India is, you know what? There's not a problem. We have 300,000 dentists. We have registered dentists, I'm talking. We have about 30,000 odd dentists passing out per year. We have about 8,000 to 9,000 dentists, MDS passing per year. This is not a problem. With the population of India being 1.3 billion, we are still short. The problem is the ratio between the rural and the urban. Everybody wants to go and settle in that one MG road of that city, the main road, so-called. If you want to go and settle in that Mahatma Gandhi road, like I said, your parents may have money, you may have money, your in-laws may have money, whatever it is. People in that are lived for generations they're living. They know anybody who comes new. For a beginner, please go and settle in an upcoming area, the outskirts. There is an inflow of population coming there. There is migrant population coming. You grow with them. So it's easy to settle. Second thing is the ratio between in cities is 1:10,000. Sullivan has given a publication in 2012. I'm talking about 8 or 10 years back publication. When the ratio was 1:10,000. Now it must be a little different. But the rural population ratio is still more than 200,000, 250,000. So no dentist wants to go and settle in a rural place. I don't know why. I know that the infrastructure in the city is good. The quality of life is good. But believe me, the so-called quality of life is materialistic in the city. The air, the water, all you get in the village is very different. You may not get good roads maybe at the moment, but it's improving. You go abroad, say even America, so-called developed country, see all your relatives and friends. They're not parking themselves in the main Manhattan. Most of them are so far away that when you go, you'll realize where they are. That's because they've got good roads, good facility, good infrastructure, good internet, and good everything. But India is fast developing. So I want you all to start thinking different. You will make it better, even going to a rural place. I am not asking you to do social service. Like when you say rural place, you'll say, no, there's no money. It's not so. Yes, there are two practices. One is called a class practice. One is called a mass practice. Now in the rural practice, it becomes a mass. But believe me, even in the rural place, there are zamindars, there are good agriculturists, there are patels, there are big people who have got money. You can do two different practices even there. You can tell them that this is another way to do it. When you have to go to one place, there's not one road, right? There are many roads. Follow any, it'll reach there. So make your own road. That's what I believe in. Yeah.
That's very nice to know. So now when coming up to settling down practices, so what are the important things that needs to be kept in mind while settling down a practice in rural or urban? What will you suggest?
It's a good question. What I want to advise the youngsters is, you have to make a game plan. Before I started my clinic, I have tested the waters. I first became a consultant to so many clinics only because I was not sure if I'll be able to run a practice or if I want to do that. Because in that time, my mind was also running, I'll go abroad or not. Is the money enough or not? Will I be able to pay my loans or not? So many things. That's because I'm self-made. I had to make myself. That's all okay. It's about 20-year-old story. So I want you all to think of this way. A businessman will always say, you know what? I want to give 1,000 days to what I want to do. 1,000 days is 3 years. That's another request I want to give every BDS or MDS who's passing out. Please do not start your practice even if you have the money. Because if you have the money and you go and start your practice, that's all what you know. Because I went to so many clinics in Pune, I have worked in 105 clinics. Last 16 years I could put. Different times, some I went on a weekly, some I went monthly, some I went 6 monthly, some only on call for a difficult case, whatever it may be. But you know what I learned? Everybody knows what to do. Even I knew what to do in endodontics. But I wanted to know what not to do. So when I went to those clinics, I always saw the practitioner. What wrong were they doing? There are so many things were not done right. I don't want to put down our practice or our specialty or our dentistry, but I've seen people not sterilizing instruments properly. Sad thing. In fact, I'll give you a small example when I have to refer this. I went to a senior dentist practice. He tells me, Vivek, can you come tomorrow early morning, first patient, 9 o'clock to me? Because you have to work on me. I didn't understand what he meant by saying that. Because he knows his own clinic after 9 o'clock is not going to be as clean. He's telling his assistant, Sab naya cheez rakho, keep everything new for tomorrow. Which means he's not using new for other patients. In our practice, what goes into my mouth, my daughter's mouth, or my wife's mouth goes into everybody's the same way, the same treatment, the same protocol. Even my daughter comes and sits in my clinic at 8 o'clock in the evening, my last patient, the protocol is the same. We have a full-time housekeeping person in the clinic. A lot of times in the clinic, there's cleaning in the morning, jadu pocha in the morning, sweeping in the evening, and done with. In between, nothing happens. Don't get me wrong. Think different. It pains me. M.F. Hussain, I always give this example. He's no more, due respect, but he's one of the best painters. His painting was selling in crores, right? Why? Because he put a value on himself. His paint and brush may be the same cost. You go to a local painter on the roadside, you will not even give him 1,000 rupees or 5,000 rupees. When M.F. Hussain comes, it will be crores. It will be in crores. Why? Play your playground. Think big. That's the difference. So I want to start thinking, dream it, but give it time. Even government has, right, Panchavarshik Yojana, means what? 5-year plan. Why are we not planning ourselves? So my thing is, test your waters. Please don't jump into starting something soon. Once you know it works for you, you're confident, forget earning money. Money everybody can earn. If you're good, the word of mouth, the goodwill will carry far. And you don't know how it will change you. That's a request I would tell Ayushi to pass on to the youngsters. Make them realize, understand through your social doctor that they have to believe in themselves and focus, of course, but be passionate and driven.
Yes. That's really nice to know. So now, when obviously after working as a consultant, what do you think are the very important points that always needs to be kept in mind while selecting a place or anything, while while actually settling down your clinics?
This is a personal choice, of course. You can make a clinic in the smallest area or the biggest area based on your situation that you're living in. But more than that, you know what I'd say? Don't waste your money on a Duco paint or a chandelier. Some people will put a Jumar lagata and all. It's a waste of money. You rather buy the best equipments. I've seen clinics, we didn't have basic equipments. You can't work on endodontics without an apex locator, for example. These are all fundamentals. Today, digital picture has come in and there's no end to it. Start thinking of it. Okay, I'll put it another way. If you have to buy a good chair, please invest in a good stool also. If you don't, the patient is going to come and sit in your chair for how long? Hardly any time. 1 hour, 2 hours, whatever it is. But the stool that you're sitting in, let it be ergonomically designed. Every dental chair will sell you a stool which is so poor and cheap, 5,000 or 10,000 rupees. Your back should have an S-shaped curve. It's lost. You don't have the spinal curve, and you'll end up, see, the procedural accidents in our profession, the hazards are what? Lower back and neck pain. Like it or not, every dentist suffers sooner or later. So if you know you can sit straight and work well with good ergonomics, what more do you want? Lambi race ka ghoda banna hai. You can work for lifelong. I have seen doctors stopping practice at 45, 50, 55 years. That's too early. Your children are not settled in life. So I want to start thinking different. So invest in, okay, I'll put it this way. To cut the story short, make a wish list. Must have, nice to have, need not have. Now, if you ask me, have I picked up digital technology today? Most of it, yes, but I have not picked up a milling machine yet. Because I saw my ROI. I can get enough loans today because I'm paying good amount of taxes. I know good companies, the CEO, so many of them I know. They will come and leave it in my place and we can work out the terms and conditions on that. But the point is, am I doing hundreds of crowns in a month? No, I don't. When I'm not doing that kind, the ROI is not working for me. The return of investment doesn't work. I don't want to pick money from there and put it to this machine. It's like I want to live for something, not live in something. Okay, so all I'm saying is, please don't trouble yourself by taking loans or overloading yourself. So first game plan for beginners is must-haves, basic app setup, but keep adding up. If you have the money and everything, put everything, I'm okay with it. But everybody's story is not that. Majority of them have to plan their lives, which we all did in over a period of time. Today's generation has got a lot of peer pressure. The stress is huge and you want to settle fastest. Settlement is not by putting a clinic place. Settlement is when you come to terms with yourself, and that takes years. When you come and say, okay, I am sorted now, I'm passionate. It's not that I don't have loans. I have lots of loans on my head, but I know we are in a system that is self-sufficient and running for itself. To come there, you have to plan your life. That's what I started this chat discussion by saying that, first 5 years I had lost myself to something which I had never dreamt. So I want you all to be a dreamer. That's all.
Very, very inspiring and very nice to know about all of it. So now, after discussing about practice management, there are a lot of courses that people actually look forward to these days. To excel or to get better, or maybe to understand that to be better at many things, maybe to be good for the patients that they come to their practices, and everybody has a different thought process to that. What is a suggestion on that from your end?
Yeah, I think these are called finishing schools of dentistry. It might be for any branch, any specialty. See, what I didn't like in the way of education in India and most of the countries, of course, it's not about dentistry, okay? It's about anything. We are all question answer based, viva based. I go to my exam with the aim that mujhe first class lana hai, distinction lana hai, yeah, about to be a topper. That's it. But that's not practice. When you come out in this big bad world, I'd say, because there's a lot of challenges that all of us have to face. It's not about what mark you've got. It's all about how well can you lead this life. So please understand one thing. Try to sort yourselves to problem-based learning, teaching process. Approaches should be problem-based. I wish our schools change that way. It's not about dentistry, it's about every school. If you had this problem-based learning, the children would have been better. They would have been taught better. I don't like that one-day examination and pass or fail types. This much of internals. I'm a teacher myself, but I'm also fighting a cause. Someday it'll change, I'm sure, for the next generation at least. So that's what it is. So having said that, when most of us pass out from the dental schools, we don't have clinical training. Not enough, I mean. We have, but not enough. We don't have enough experiences. Like personally in endodontics, you ask me, have I treated a radix case? Have I treated an open apex case well? Or have I treated a C-shaped canal? No, I didn't. In my post-graduation, maybe some, but we didn't have any protocols. When I say protocol means, today we know what to do, which channel. We went on doing as it came. And we had good teachers, great teachers. That's why I would say, at least my fundamentals, my basics are strong. And whatever came, by the way, came much later after I passed. Including the small things like apex locator or say gate student drill or the rotary instruments or say RVGs. I'm giving you small names, or the lasers or the loops or the microscopes. I can go on and on. Everything came after 98, 99. 2000 was a big change for dentistry. So I would put it another way. I met another young student, I'd say. He's an intern now. He came and said, sir, I'm not having any hopes on dentistry. What do I do? And like he was wanting a pep talk with me, one-on-one. I made him sit. You know what I told him? I told this in some other platform also. If I was born as a dentist again, this is the time I would choose. I know there's a lot of competition, but fight it. Competition doesn't mean it has to be healthy. Also understand one thing, with digital technology coming in this much, when you have loads and loads of technology happening in every front, you have artificial intelligence coming in, you have deep machine learning happening, you have every form of digital technology in with not only about scanners and millers, but everything. Navigation is coming in, CBCTs are there, and you name it, they're all integrated. Today you can navigate yourself into a root canal system, into a bone system for an implant or anything for that matter. There are stent guided therapies, there's reverse engineering happening, what not. Yes, it needs a good amount of push from yourself. And to the question she asked, do I need to take up these courses? Yes, you need to take up a lot of courses, not one course. Try and understand the best from everybody. I would say one statement to close this by saying yes. There's a good statement I read somewhere else before. It says this much. Whenever you meet somebody, there's something that he or she knows that you don't. Don't let them leave before you learn it. You understand? It's not about a teacher, it's about anybody. Now you're thinking of courses, should I go and learn from him or her? When you go and learn from him or her, that teacher or that clinician, that educator will have few points to give you which you don't know. Pick them. I know it'll come for a price because weekend workshops and academies charge you money. But they charge because even they will go and upgrade themselves. I do myself. I have workshops and academies. But the money that I earn from that workshop and academies for me to go abroad, to upgrade myself, to Indianize those, and try and come and share the view that I follow their principles if so. So that's going to help each other, right? Yes. That's what I mean. So try and do a lot of online courses, offline courses, but dentistry is about art and science. Pedagogy is definitely there, but you need to build up the art. For that, you need a lot of clinical training, a lot of hands-on. I tell my postgraduates, I tell anybody who takes up my course, you know what? I call it my first 100. You want to call yourself decent, you have to do your first 100 teeth. For me, it's root canal, 100 re-root canals, 100 microsurgeries, and then only I'll get into the field to work or talk or speak. I don't want to do my first case and show it on the screen and social media and say I'm so and so. I don't believe in that. I want to see my failures and then go to the success, because success most of us are getting. But if you can handle your failures, I think then you're there. You've reached.
Correct. So rightly said, sir. Definitely. So now, when it comes to courses, there you are a founder of One Dental as well. Yes. So what exactly it is all about, just for our viewers to understand what all is there inside One Dental?
Okay, it's a good question. One Dental was a brainchild of mine, of course. It came in only because, you know what? I am 19 years old with a 30 years experience. Okay, so I'm 49 years now. In the last 25 years of my career, I've traveled a lot of places around the world, of course, for good reasons. And dentistry took me there, nothing else. It's dentistry that took me there. I have still not been able to go to the northeast of the country. The Seven Sisters, I have not seen. So I someday want to go to Assam, Meghalaya, and all those places. But the point is, I started thinking to myself, if I, being so blessed in many ways, could not reach there, they also would feel the same to come. And we have a lot of good people around the country and the world who can bring in good quality education. Like I said, college teaching was a different style. When people pass out, they're short of knowledge in some ways, clinical expertise nahi hai. Wages are so low in some places. They're not getting jobs. So I said, why don't we start something what books don't teach? Which means it's clinical, a lot of clinical stuff. So if there's another way to do it, why not? So we started this One Dental, but again, I want to test waters. So we started something like webinar series. 2017 is what we started. We did a webinar with, say, 6 or 8 speakers, and then we went on with about 15, 20 speakers. We did for an Indian Endodontics Society, another congress, and we realized the amount of people coming and watching that were in thousands. But it was webinar, time-based. Then 2018, I said, why should it be timetable based? I don't want to be cable TV. I want to be Netflix. You click and watch anytime and every time. So 2018, we came with a package. We came with a yearly package. We came with a monthly package. We came with pay-per-view ticket views. We came with certificate courses. We came with short videos. Why? Because I realized when you give long videos of 1 hour long, nobody has the patience. The advantage of online teaching is you're getting the best of clinicians. We've used the best of studios. We have green screen, glass screen recordings. We have high definition recordings. You should see one of our videos. There are a lot of free stuff available in there. I'm sure Ayushi will share it with you. Yes. Why I'm saying this is I've bought about 70 or 80 of the speakers who have contributed to our platform, and they're still growing. We have more than 15,000 minutes of content. If you spend even 30 minutes per day, 1 year is not enough to complete. That's the kind of content you have on all the subjects. It's not about endo. So what we decided is, yes, at least one part of the story, at least art and science says that. Science let us teach this way, like what books don't teach. And then when you come to a clinician, when you come to somebody's course, can go to a workshop, do a hands-on, you know the theory behind it, you know the clinical aspect or application behind it. So that's how we started. Then we also got ideas. We decided in 2018-19, we also will complete a life cycle of a dentist. Because what's happening is, why are we doing dentistry? For whom? It's for the patient. So we are here to raise the bar of dentistry. I want all of us to give good patient education and standard of care for our patients. And that will only happen with good education. And it starts from within. So we started doing some with free, some with a fee also. So that's how it started. Life cycle of a dentist. So beginners, we said, just who's passed out may not want to watch videos because they're not practicing. I said, somebody interested in PG or going abroad. So we have 10,000 questions, which is free. And it is based, you can set your paper. You want to pick up 100 questions of different topics like biochemistry or anatomy. You pick up and make your paper and click your answers. It'll tell you right and wrong. And you can play around with the 10,000 questions. That's for the beginners, for who want to do PG or go abroad. Then we said, we'll make clinical skill program like short videos, 3 to 5 minutes. You just sort of plug in your earphones or otherwise watch on your pad or your iPhone or your laptop. from home to college, college to clinic, one video. Did you know there was another way to do this? And we have a video for that. So that's how we went on doing. We've got about 550 or 600 videos of those, and we're still growing. Yes. We also have long videos. We have basic course, interim course, and advanced course of different specialty for different people. We have infection control programs. With COVID in place, we have lectures like sterilization. People should know how to sterilize, why to sterilize, what to, class B, front loading, top loading. There's so many things. I myself did not know as a student. I came out and it took time for me to understand and learn. And today I know, I decently know a few things. And I said selflessly, let me share a few things. So even in the open education platform, we have speakers who come and share free of cost. And we give it. So you don't have to actually pay for it. All what we need is go and click into that, and you will see that you'll get to see a lot of free stuff. There are 30 odd free videos, some long, some short, many of them. We also thought, why not anybody who becomes a member gets credit points. You click every day, you get 1 point. You complete a video, you get 1 point. You get certificates for that. So people are using that. And today, of course, there are universities asking for online credits. So there are international students and Indian students buying that for us. So these are a few ways we have increased. There are doctors coming and teaching on that platform. They get a fee for that. And believe me, they get maximum fee. I have contributed for some of the textbooks, but the royalty what we get is just 10% or 15%. 85% they take and go. Who? The publisher. Then they will end up telling the marketing cost, the manufacturing cost, the publishing cost, whatever it is. But entire brainchild is mine. For my skill and my brain and my expertise, you're taking 85%, I get 15%. Here it's the other way around. The website will take a small conversion fee, but maximum money is yours. And that too, it's the algorithms are all set. At the end of the month, you get whatever you earn. So a lot of people can come and teach there. It's called Earn on One Dental. You can give to somebody as coupon where they can, share it with others. So there are many things that are happening in One Dental. So it's like a dental hub for us. It's a robust website. There's lots of things happening and many more to come. So we're planning that it grows and grows. We've actually covered at least 132 countries and more than about 150,000 people, I think, close to. Exact number I won't be able to tell you today, but it's growing every day. We have, a lot of people coming in to view us. Yes. And there are a close net of people who have actually paid for us. They get a separate work, feeds every now and then. We're also in the social media like Instagram or Facebook. And so please follow us. We also give small clinical tips, some reels, some short videos of some different procedures. Yes. There are companies participating as educational partners, like Carl Zeiss. You can buy products. We are not involved in any sales there because they have supported our platform because of their educational partnership. That's a one-time fee. But what they give you, you'll never get anywhere with any dealer. That's why I request. I told them, if you're coming to participate in my platform, make a price where it's not available anywhere else. So if you want to buy a loop or a microscope, you can see that. And if it suits you, you can directly contact them. We are not involved. I don't know at all. But yes, this is how few companies got benefited. Ultimately, it's amalgamation. I believe in networking. I also believe in we have to go in collaboration in the long run. Yes. That's how we grow, that's how it is.
Yes, definitely. Yeah. It's such a noble cause with One Dental that you are doing for the enrichment and the growth of the knowledge of all the upcoming dental graduates. And actually, just go on the One Dental website, just register yourself there. And there is one program called One Step with One Dental membership. You get enrolled for that and you have more than 30 odd videos that are just free of cost with so much of knowledge, with small tips that can actually help you to become good practitioners. Some of the videos like understanding how to put rubber dams, how to understand basics of occlusions, how to prepare cavities, some very basic things that can actually help you to become practitioners that you're doing on an everyday basis. But some small tips from those experts can make you a better practitioner and do better for your patients. thank you, thank you so much for helping us, our viewers, to understand about One Dental, to understand how they can actually go across that and become better practitioners. I'm, I'm sure, each one of them will try to go there and understand about One Dental, because it's such a noble cause and such a nice platform to understand. So coming back to to understand about practicing as a dentist, with COVID, people are still confused how to get back to practices. What is your suggestion, and what any motivational thing from your end for them, how to get over this phase?
I have a good lecture on COVID also, practicing before COVID, practicing during COVID, practicing after COVID. The topic is practicing at all times. See, COVID one way is a blessing, that it's a wrong thing to say maybe because nobody wants it, but because it came, a lot of things changed for us. Like the sterilization protocol, the hygiene maintenance, forget dental clinics, even outside, because of the mask, I see people spitting less nowadays. So many things have improved. During that lockdown, the air quality was so good. It was summer, still we didn't feel it. The point I'm trying to tell you is somewhere we are also getting a big part in spoiling the climate change, big hue and cry is happening. So I think we have to be responsible enough to bring in things back. But having said that, COVID is not going to go so fast. We have to learn to live with it. Follow proper hygiene. See, there are only 4 hygiene. Hand hygiene is first. More than sanitization with some alcohols, please wash your hand with soap and water. The disruption that it does to the protein layer with soap cannot be done with alcohols. Alcohol is once in a while good in between. You watch the video for the scrubbing technique. I myself was not doing it well. There are so many areas you need to cover, which I was not doing it. All these areas, I used to miss it. We just wash hands for the namesake and it's done. It doesn't work like that. It will work this way. There's so many ways to do it. So see those videos in One Dental. I'll possibly try and see it's made it open now. And that's how it is. And more than that, first is hand hygiene, face hygiene. Minimum a mask, but I'd say if you're working in the clinic, I would wear 2 masks. See, ultimately, which are the routes of entry? Commonest is oral and nasal, right? But they say close all portals of entries. So your ear should be covered with the head cap, place an eye cover, the goggles or the shield. I put both. I put loops and my shield. Plus double mask, one N95 and one a lesser mask, maybe a 3-ply mask. And the 3-ply mask is thrown after every patient. My N95 goes on for the whole day. And then the N95 comes back on the 4th day. So there are few CDC guidelines. If you follow that, you can keep in paper bags, you can keep in breathable containers. There are many ways to do it. I think if you can see the lecture of mine, it's in total depth. It's about 1.5 hours. I've covered everything possible on how to practice. We also see our patients follow the same hygiene. We don't allow the patients to bring their bags, purse and everything inside. They have to keep it at the reception area where we have a designated area. They will do the hand hygiene. They'll keep everything of theirs. We give masks, we give them head cap, we give them gloves, and then they enter. Because if they end up touching all my clinic, there'll be a trouble. Because I don't want, I'll put it this way. We started working on after the 3rd lockdown, that is May 18th. We started alternate day. We started for 3 hours, then made it 4 hours, then made it daily. Today, we are working, like the last few months, we are working every day, full day. Except that before and after, we have a break for a good cleaning, we open the windows for good ventilation. It's called ACH, air circulation per hour. It's called CADR, clean air delivery rate. These are a few things you can calculate per square millimeter, per square meters or feet. They're all there everywhere in the internet. You can search. The sprays are used. We have fumigators. We have your choices. You can put HEPA filters. You can put UVGL lights. There are plenty of things available. Everything is not needed, but some things are. Now you see what suits you. I know there are people who work in 1-room practice. I can afford it today because I'm talking 20, 25 years down the line where I've reached where I want to do. and have a bigger place. But even smaller places, convert your reception, work on appointments, let the patient wait outside, call them only when it's needed. I've helped a friend convert the reception for donning and doffing. Even in our reception, there's no called reception. You can wait in the car. My patient can afford a car, but in smaller places, if they're coming walking, it's okay. So what? Wait outside. I'll call you when time comes. Today, everybody has a mobile. It doesn't take time. So when the cleaning is happening, my earlier patient is gone and the next patient enters. So they don't actually clash. So this is how we follow. We have multiple operatories. So it's only when the other operator is working, sometimes there are two patients, but we have a bigger place. Like I said, it's possible. We also see that when they're going there, two people are not in the entrance. So there are a few things that my staff take care. It's a system that we have practiced. I made a small video of the same thing. It's in the social media. If you follow the White Earth Dental Center, if you follow One Dental during May till say about June, July, we put a lot of COVID protocols, a lot of videos, and they're all free in Instagram. They're free in, I think, Facebook. There's so many places. YouTube, you'll find it everywhere. So follow One Dental. I'm sure you'll get good protocols.
Yes,
But I'm not saying everything has to work for you. Believe what works for you. Make that happen.
That's so true. That's correctly said. And I'm sure if you want to connect with Dr. Vivek Hegde, do follow him on One Dental on Instagram, Facebook. He will get back to you and definitely reply you. So now understanding everything about this, any motivational quote that has kept you motivated till now, these 25 years. Okay. Although we have, known a lot till now, but still something that is always with you that, that keeps you dreaming always.
Okay, I'll quote one of those which I quoted in my master thesis. I really believe a lot in that. It said this way, it's by Thomas Jefferson. What he said is, I am a great believer in luck, and I find the harder I work, the more I have of it. So everybody says he's lucky, she's lucky. I don't think so. You know what? Luck is what? It's basically when be prepared, when preparation meets with opportunity. If I'm prepared and if there's an opportunity, it's mine. A lot of time opportunity comes and people are not prepared. So be prepared, work hard, work smart. I don't know tomorrow if I'll need something, but I've started working on some things in my mind, some projects. But if that clicks, if that opens up, I'm there for it. I'm ready. But I lose nothing. I even get more educated. I become more, wiser. My wisdom increases, and that's the passion I follow. So that's what I would say, Be a great believer in luck. But luck is what? When you work hard, luck will follow you. So luck is when you have preparation, because you want an opportunity to strike you, right? So that's the quote I tell all of you, please. Yes. Believe in that. It works for you. It works for me. It works for everybody.
That's so true. That's so correctly said, sir. And we have a lot of positive comments for you. Dr. Mukesh is saying master of masters. Dr. Avatar is saying you are fabulous. Dr. Asma is saying very well said, sir. It was a pleasure listening to you. Dr. Mandeep is saying such a learning session, sir. Dr. Shrikant is saying valuable speech. So nice to listen to you, sir.
Thank you.
So there are so many people who are inspired by you, listening to you, understanding such basic things about practicing. And I'm sure do register to One Dental. That will help you to get a better practitioner. It is an amazing platform. I have visited it. That is the reason I'm telling each one of you to go there. There are a lot of free videos there that will also help you to actually enhance your basic skills, basic things that are very much necessary for your everyday practice. Thank you so much, sir, for guiding us today, for being with us, for inspiring each one of us in the way you have just did it, in motivating each one of our listeners. Thank you so much for joining us.
Thank you. Yeah. I must thank Dr. Ruchika Rungta. She's the one who put me across to you to speak about the few upcoming projects that are happening. Thank you so much, Dr. Ayushi.
Yes.
It was a pleasure being in this program. I thoroughly enjoyed it. If anyone wants to connect us, connect to me or our organization, or any help from me anytime, feel free to reach to me. Thank you so much. Thank you very much.
Yes, do connect on One Dental, as already mentioned, on Instagram and Facebook pages, as well as thank you so much each one of you for joining us at this time in this inspiring discussion. Also do follow us, The Social Doctor, on Instagram and YouTube channels. You can find all our old videos there that can also help you with your career growth, as well as share this video also with all your friends and colleagues, because this will help them in a very positive way to understand what all are the right practices for them to become better practitioners, and also inspire them to make a better future for themselves. Thank you so much, everyone. Thank you so much, sir, for joining us. Good night, everyone. Have a nice day tomorrow.
Good night. Bye.
Bye-bye.